Reaching for a painkiller the moment your back flares up? You might want to hold off. Doctors say the first step for most low back pain is not medication. Instead, they recommend starting with non-drug treatments first. Really? Non-drug treatments? I get it. Most people with back pain have already tried something like that. Physical therapy, exercise, stretching, massage, yoga, and so on. We all know they are good for us, but here's the frustrating part. They take time, and they require your effort. And how can you focus on posture and breathing exercises when you're already in pain? What if there was something that could calm the pain quickly, almost like a pill, but also help your body actually recover? Think of it as a kind of third way. A method that acts as fast as a pill to shut off those sensitive pain signals, but actually facilitates resetting your body's structure and movement. The American College of Physicians, which is the largest physicians association in the United States, representing over 160,000 doctors, put this third way in their recent back pain guideline as a must-try because it's shown consistent benefits in clinical trials with very low risk of side effects. The answer is neuromodulation. In simple terms, it means calming an overactive pain signal in your nervous system. And I'll show you how it can flip the off switch on your pain. Unlike basic physical therapy, this approach offers near immediate relief without the side effects of medication. It doesn't just relieve pain, it also helps your muscles, ligaments, and tendons restore and strengthen, so everything else you're doing for your back can finally start working the way it's supposed to. But here's an important thing. These guidelines focus on what doctors call non-specific back pain, meaning back pain with no serious underlying causes like a fracture, infection, or cancer. And this is actually the majority of back pain cases. Even if your MRI shows disc degeneration or a mild bulge, that doesn't automatically mean those findings are what's causing your pain. When there are no serious red flags, non-drug therapy comes first. Most non-drug therapies work by changing how you move, but this particular method works directly on the source of pain by placing a very thin needle at specific points along your nervous system. That needle acts like a tiny conductor. When it touches a precise location, it activates local nerves, connective tissue, and immune cells. It increases blood flow, calms inflammation, and quiets the pain signals before they get amplified by your brain. Acupuncture is unique in that way. It's non-drug, but it creates direct biological change at the source of pain. And it even improves movement and function. In other words, it gives you passive relief like a painkiller would by directly calming the nerves and inflammation in your painful back without you having to do anything. And it prepares your body so your back muscles and connective tissues can actively engage in long-term recovery. Truly, it's a bridge between passive relief and active recovery. Let's start with what happens right at the site of the needle. When acupuncture is applied to a painful area, it sends a direct message to the immune cells in that tissue, telling them to calm down and shift from damage mode into repair mode. The inflammatory chemicals that have been irritating your nerves start to decrease. Blood flow improves. The tissue begins to clear out the chemical waste that's been fueling your pain. Less irritation, more healing. This isn't a metaphor. It's a measurable biology happening in your tissues and cells. But here's where it gets interesting. That effect doesn't stay local. Imagine your nervous system is a home security alarm. When you hurt your back, the alarm goes off, as it should. That's pain doing its job, telling you something is wrong. But in many people with back pain, the alarm stays on long after the danger has passed. The system gets stuck. And now even small movements, like bending over, sitting for too long, lifting something heavy, trigger that alarm over and over again. What acupuncture does is find the right circuit and reset it, not just at the painful spot, but all the way up the line. When the needle is inserted at a precise point, it sends a signal that travels up your nervous system all the way to your brain and activates your body's own built-in pain control network. Your brain responds by releasing its own natural painkillers. The overactive alarm starts to quiet down. And we're not just theorizing about this. Researchers have actually watched it happen in real time. Using brain fMRI scans, multiple studies have shown that acupuncture needle stimulation visibly activates specific regions of the brain, including the areas responsible for processing pain, regulating emotion, and triggering the body's own pain-killing hormones. You can see the brain literally changing its activity pattern right there on the scan. And that's why many patients feel relief not just at the needle site, but throughout the whole body, sometimes within the very first session. But we go even deeper than pain and inflammation in the nervous system. When your back hurts, something else happens. Your muscles and the connective tissue around them, like ligaments, tendons, and fascia, all strain and tighten together. Over time, these layers start to compress and stick to one another, almost like layers of plastic wrap that have been crumpled and pressed together. Blood can't flow through it properly. Waste products build up, movement becomes restricted, and no matter how much you stretch, foam roll, or rest, you simply can't reach those deep layers from the outside. This is where mechanical needle stimulation comes in. The needle physically reaches those deep, compressed layers of muscle, tendon, ligaments, and fascia and begins to release the areas where everything has become knotted and stuck. It restores the circulation, it creates a space for the tissue to move the way it's supposed to. And it sends a direct signal to the cells in all of those structures. Start rebuilding healthy tissue here. This process is called mechanobiology, and it simply means that a precise mechanical signal in the tissue can trigger real structural repair from the inside out, something no stretch or massage can fully replicate. Now, you might be thinking, isn't this what exercise and meditation are supposed to do? Yes and no. They work through some of the same pathways. For example, yoga, meditation, and Tai Chi movement, they all help calm your stress response, reduce tension, and over time, ease pain. But here's the key difference. Think of your nervous system like a car engine that's been running too hot for too long. Exercise and meditation are like gradually improving your driving habit, which is essential for the long run. But to build good driving habits, you need the engine to be in a workable state first. Acupuncture is like opening the hood and directly cooling down the engine. It works from the inside, stimulating the exact biological pathways that exercise can reach, but without requiring you to move through the pain to get there. That feeling you get after a really good meditation session or at the end of a yoga class, that sense of release where your body finally stops bracing, acupuncture can bring your body to that same place. It calms the system enough so that the other things like stretches, the rehab, and the lifestyle changes can finally take hold. We've seen so far the science behind the needle and how it resets your nerves, releases your tissues, and calms the system from the inside out. But does this biological reset actually hold up in average patients? The answer is found in the most extensive acupuncture studies ever conducted on back pain. In the largest clinical trials, thousands of patients across Germany received 10 to 15 acupuncture sessions over several weeks, often delivered twice a week. The results showed that nearly half of the patients experienced a 50% or more reduction in pain intensity. More importantly, these benefits were sustained even months after the treatment ended. This is not a band-aid, it's a cumulative biological therapy. Just as you wouldn't expect one workout session to change your body in a day, your nervous system and damaged tissues need a consistent series of resets to truly remodel and heal. I'm talking about hard data, and major medical journals and Doctors Association confirm acupuncture as a standard care for back pain, alongside exercise therapy, spinal manipulation, and behavioral approaches. If you've been bouncing between pills and other non-drug therapies because neither was giving you true relief, there is a third way. Don't just manage pain. Start recovering by addressing the source, resetting your nerves, and repairing the tissues. You know what most people say after treatment if they never had acupuncture before? I wish someone had told me about this sooner. Now you have it.